This is Sherry Strite from Delphini Group, and I want to talk to you about what I and my partner, Dr. Michael Stewart, consider to be a true tragedy and how we hope to be able to help improve things. Mike and I refer to this tragedy as the great big medical misinformation mess, and it pertains to failures in our healthcare system having to do with information, communications, and engagement. At the heart of this tragedy is that often patients cannot give informed consent, and frequently that's because much medical science is not trustable or clinically useful. And unfortunately, most healthcare professionals do not know this, and even if they did, most don't know how to tell that which is trustable or not, and most don't know what information to cover with patients. The start of the healthcare journey should be all about information, and this is where we get into information, communications, and engagement. So it should be a back and forth between patients and their healthcare professionals advising them. That then should lead to a decision to action, action to outcomes. Unfortunately, we're all at risk for a really bad outcome in a typical journey. Oftentimes information is absent or it's misleading in some way. Patients haven't actually provided consent, they don't know what they're consenting to, or the decision is somehow not informed. And then when that happens, actions can lead to bad outcomes. Just to give you one example, as a baseline, be aware that about 58,000 U.S. lives were lost in the Vietnam War. And then compare this with an estimated 123,000 preventable deaths from two common treatments that we believe would not have been prescribed if doctors understood better the basics of evaluating medical science and then shared that information with their patients. Instead of understanding the quality of medical evidence, frequently doctors focus on diagnosis and doing, and then we have that combined with patients wanting something done, and that's a prescription for overuse. And overuse results in harms, missed opportunities for right care, and for waste. We all deserve better, and we think that we have some ways to help people achieve this. So here's what we think that we all deserve as patients. We think we deserve the right care in the right way at the right time, and that means reliable and useful information combined with good communications, resulting in decisions and actions that meet patients' unique personal requirements. And we define that as a patient's personal healthcare problems, their own special circumstances, their personal values and preferences, and these things go into informing what we call a patient's healthcare needs and wants. The medical misinformation mess is due to key failures in the key building blocks that are needed to support patient decision-making. And these have to do with information that is reliable and clinically useful, effective communications, and effective engagement with patients. And here's what's required to correct this problem. We need improved education of healthcare professionals and others who are involved in or affecting medical decision-making. This includes knowledge of the medical misinformation problem, training in medical science basics, which can be very simple to acquire, and in evaluating medical research for reliability and usefulness, which is not necessarily that hard to learn the basics, plus help to improve patient communications. And this is going to be requiring also improved public awareness and education, and then ultimately people who are willing and helped to actually change. And if those things change, that should result in needed changes to educational content and methods, research conduct and its reporting. That includes not only journals but the media, the quality of content, and that has to do with resources for patients and healthcare professionals and support for using those resources, and additionally, very specifically, communication aids for information, decision, and actions. And healthcare providers' care and communication approaches, patients' expectations and actions, and then other drivers for healthcare, such as those from policymakers, regulatory decisions, accreditors, etc. So let's take as an example healthcare systems. You can break healthcare systems down into three major components: leadership, work components, and culture. And in order to affect the great medical misinformation mess, here's what healthcare systems need to do. Healthcare systems need to form an organizational environment in which reliable and clinically useful evidence informs all of these components of leadership, culture, and work components. And so an evidence-based organization is a system that identifies and closes gaps in quality, satisfaction, and cost by applying applied evidence-based medicine. And we talk about the 5 A's here: ask, acquire, appraise, apply, and then updating that again. Evidence should be a part of the mission statement and quality plan, and also the business plan, to demonstrate a commitment to a sound evidence-based approach. And to ensure the evidence is of high quality, the organization has to be engaged in effective critical appraisal. So leadership needs to support an evidence-based approach that's an appropriate one with principles, structures, and resources. And those structures should be organized around principles, standards, and criteria for an effective evidence-based approach. Staff should be given effective roles, concepts, methods, processes, skills, and tools. And appraised information should be converted into useful and usable communication aids. And we are here to help. Delphini Group has solutions for all aspects of evidence-based clinical improvement work, including communications with patients. We perform evidence reviews, we conduct training programs, and we facilitate evidence-based clinical improvement activities. Importantly, the basics are not that hard to learn or to apply. Don't worry about statistics. You can get a statistician. Usually that's not the issue you have to worry about. What we will show you is the basics can be learned in a few short hours, and we have freely available tools, tutorials, including videos, all of this online. We are available for instruction in greater depth, including customization for groups, doing specific projects, including clinical improvement activities, committee operations, clinical guidelines, and communication strategies. And here are some things people have had to say about our training programs. Our mission is all about improving healthcare quality and use of resources through evidence-based practice and effective communications and engagement with patients. And to do this, we can help people bring science into medical practice in an easy-to-understanding way using our tool-based approach. And we also want to build competencies and confidence for people and provide inspiration to them. We have a lot of information that's freely available at our website to help with evidence-based clinical improvement activities at www.delphini.org. And we have books available, a 6-part series in fact, and we have some videos available to help. Our most recent book is for patients. What You Don't Know Can Hurt You, a guide for patients. And all of our books are available at Amazon.com, and you can go to our website at delphini.org or delphinigrouppublishing.com to read what is really unique about this book. And we also have a lot of resources freely available for patients specifically as a result of this book as well. That's delphini.org or delphinigrouppublishing.com. We have some videos available on YouTube, also accessible through our site. And one of the most important ones is 20 minutes for how to critically appraise a medical research study. Fast, efficient, and effective. We have a 3-minute quick markup method. And then we have measures of outcomes. And in between here we have a video about our patient book and why it is so unique. What we are trying to do for patients is really make them aware of the medical misinformation problems, limitations in the healthcare system, with advice for how to work with their physician to get the care that's going to be in the best interest for that patient. We also have a video that's dedicated to helping people understand why critical appraisal matters so much, and that is the power of reliable and clinically useful evidence for improved outcomes, value, and truly informed consent. This is also available on YouTube. In closing, we believe that information about the quality of the medical science supporting medical recommendations should be the right of all patients, and therefore healthcare professionals engaged in helping patients with medical decision-making should possess basic critical appraisal skills. And as we've said before, these skills are not that hard to learn and apply, and they need to possess effective communication skills to be able to impart information to patients. So we're looking for other people to work with who share an interest in this mission, or people who would like to engage us to help them. So if you'd like to further discuss the medical misinformation mess with us, or how to advance evidence-based clinical quality improvement, or if you believe that we can help you, please contact us. You can find us at our website through Contact Us, and our email address is delphini@delphini.org. Thanks for listening.